Hello, hello, welcome. This is Here's to Your Good Health. My name is Linda Prezioso. I'm a nurse practitioner at Family Medical Center, and this show is for you and about your health. Today we have one of my favorite guests and favorite people. I've known Dr. Boyette for a long time, Dr. Doug Boyette, who is the medical director at UNC Nash Hospice. And we're going to talk about things that are not exactly Christmas, present opening discussion, but such a very, very important discussion. And unfortunately, death does not know that it's Christmas or Thanksgiving or Easter. We can have that happen anytime. So we're going to talk about end-of-life issues. We're going to talk about hospice, the hospice care, what it is, why you should have it, what good is it, are there benefits? People hear the word hospice and they want to run the other way, but we want to run you to hospice, not away from hospice. And then to make your end-of-life decisions. That's really the conversation you should have now with your family. If you are getting older like me and need to have a will drawn up and make sure your estate is in order, or your minute estate, as in my case. But you don't want to put all this on your kids. They're already suffering because they've lost their parent, and they don't want to have to do all that. So if we can have a lot of decisions already made and put together legally, then it's just a matter of your children picking this up and saying, this is what Mama wanted. So, without any more of my yapping along, we're going to say, hi, Dr. Boyette. Welcome.
You just made me think of something. And for the viewers, we've not really planned anything. We tend to be off the cuff with no apology made. I want you to hear what really happens in the real world.
Yeah.
As a doc and a nurse practitioner, we'll come out of the room, we may see each other in the hall, we may sit down and say, let me tell you about a case. Mm-hmm. And you're talking about making decisions ahead of time, and that's one thing we want to cover. I'm going to go off script. This is a local show, and so a lot of people may know who I'm talking about, and that's okay. I'm not going to say names, and these individuals would be comfortable with this, but it's fresh on my mind. It's the real world. It's what really happened. And let me kind of go through it with you. Sure. And you fire off questions, and you don't know anything about the case, I don't think, and see where we go.
Okay. So how does one get a hold of you? What does somebody do if they want to talk about putting Mama into hospice?
Hospice and Palliative Care of Nash General Hospital, I think, is our official name now that we're allied with UNC, referred to more as Nash UNC Hospice. Our number is 252-962-8124. The big thing to know is people assume all hospices are the same. They're not.
No, I can tell you that.
And most hospices are for-profit. That may be good or bad. You can argue that forever. I think it's the heart of the people in it, and I should say the heart of the people that are making the money from it, because the healthcare workers in it may be really compassionate, kind, but if they're being pushed by a dollar sign, that does affect how you do. It's
Absolutely.
just the truth, okay? Call it like it is. But we are the not-for-profit hospice in the area. We've got, I've got nothing pushing me. Honestly, as far as the hospital is concerned, as long as we're not losing money, we pretty much have free rein to do the right thing. And that's a wonderful blessing.
You do have something pushing you, and that's your passion.
Thank you.
You do.
Thank you.
And you
And
have become more and more passionate as the years go on and you've been in this position.
Have you seen that?
Yes, sir.
Thank you. Thank you. Because I am. You know, one of the things I prayed for was, I loved when I delivered babies. That was my passion, especially really, really sick pregnant girls. Because you can make a difference, and if you manage things well, you get 100%, i.e., baby comes out 100%, mama comes out 100%. That's hard to do in any other part of medicine because usually people have a lot of pre-existing conditions.
Right, right.
So I loved it, and I prayed that God would give me a passion for something in hospice, and quite frankly, dementia has become my passion. Don't get me talking about dementia today if you
All
do.
right, no dementia today.
Yeah, well,
Maybe another show.
Yeah, we'll
just
never
on
stop
dementia.
because that is.
It is such an important subject.
Dementia is the worst death, okay? When you hear somebody has cancer and you hear somebody has dementia, be sorry for the dementia family, okay? And I emphasize family because they've got a tougher go of it,
Right.
most likely, than the cancer family. But let me tell you about this situation. Guy, healthy male, out for a run with his wife, mid-50s, no health problems. Yeah, looking back on it, maybe some chest pain the previous week or two, but who doesn't have chest pain when we're running and the weather's getting cold and we're
Right,
breathing in cold?
right,
You know, I mean, you look back and I could have done this, should have done this. You can't play that game.
Right.
Anyway, sudden cardiac arrest. CPR is done very quickly. However, downtime probably in the 20 to 25 minute range.
Yikes.
Okay? Comes in, he's intubated, i.e. a breathing tube is put down and put on a ventilator, and all kinds of head scans and stuff. You think about the heart, but at this time, without oxygen, you really worry about the brain probably more than the heart.
Sure.
But both of them are kind of vital for life, you know. But anyway, now you got to make decisions. And who was planning in that family for what if this happened? Most people, most families are like, I don't really want to talk about that. And so there, if you have not assigned, when it comes to advanced care planning, people talk about a living will, which is important. But a living will basically says, I don't want to be on a breathing machine. That's kind of the gist of it. The thing is, there are a lot of decisions that need to be made between whatever the event was and the decision about a breathing tube and ventilator. You know, how aggressively do you treat pneumonia? How aggressively do you feed? Do you put a feeding tube down? Do you put a feeding tube down? Do you put a feeding tube in? There's a lot of decisions to be made. And what I want to emphasize to people is you need to assign a health care power of attorney.
Yes.
Now everybody says, I've got a power of attorney. Well, they are usually talking about the financial piece.
Right.
And I have nothing to do with the financial piece and don't want anything to do. All I care about is who's making decisions for the patient.
Right.
And as a doctor, and nowadays you're talking about groups of doctors, it's nice to have a person to go to.
Right.
And the person that's sick, that cannot speak for themselves, hopefully has assigned who that person is.
That's right.
Now, it may not be their wife, husband. They may say, you know, and I've had to consider this, you know, will my wife tend to vote with her heart and not with her head?
And she might.
And I don't want somebody voting with their heart.
That's right.
You know, there are a lot of things worse than dying. Our culture doesn't appreciate that. There are a lot of things worse than dying, especially for me as a Christian. I've accepted Christ as my Savior, not worried about where I'm going, okay? So for me to be here existing, not living, but existing, would be far worse than to be with the Lord. I mean, that's just, and there's a lot of people that would feel that way. Well, you've got this 50-odd-year-old gentleman. He's on a ventilator. He's got a tube down. We're going to have to do some kind of nutrition because he's not eating. Various scans are done, MRIs, CTs, excuse me, neurological consultation, and you know you've got this group of docs that take care of the heart, this group take care of the brain, this group takes care of your general medical stuff, you know, and you're in there, and the heart people say, oh, his heart's doing well. Well, the family hears, oh, that's encouraging.
Right.
The brain people say, oh, we're seeing signs of improvement. That sounds good too, you know. Well, holding our own. Well, you've got to whittle it down, especially with this brain group, okay? Because when neurology says there's improvement, you've got to really get them to bring it down to what would the patient consider as improvement, okay? They might consider improvement, they can move their fingers today and they couldn't yesterday. Well, that can be true. But what you really want to know is what's the best we can do? How are we going to end up in the best we can be? And would that be what, in this case, my husband would want? That's hard. Yeah. That's hard. And you know, you've got doctors, and we're people too, okay? We're people too, and we're sitting there thinking, I want to do my very best for this person and their family. But what is the very best? Because you most likely don't know the person. You don't know the family dynamics, and every family's different. So what's the right thing to do? And docs tend to think, I've got to do everything possible to preserve life. Do you? I don't know.
Well,
go. Yeah, I mean,
you know,
beat me.
Of course, you want them to live, but there's a difference between living and a difference between existing.
Say that again, Linda, please.
There's a difference between living and a difference between existing.
Amen.
He could have been on a ventilator. He could have been on a feeding tube.
Just crawl under, they won't see.
He's making jokes over here.
That was a good sneak.
But if he doesn't have any brain quality, or if he's not going to wake up and be the man that she was married to and the daddy that of his children, you know, people don't want to be vegetables. And I can tell you from personal experience, long ago, before I was a nurse, I made my mother a vegetable, thinking I was doing the right thing. Put a feeding tube in her.
Yeah, tell me more.
You know, she was at the hospital. She had dementia. And I know. Don't get on your soapbox. This was a long time ago, 30 years ago.
And 30 years ago was different.
Yeah.
It was.
Yeah.
Let's be fair.
But, you know, so they said, well, she's not eating, and, you know, and of course people think, not eating, oh, you've got to eat. You've just got to eat.
I can't let her starve.
No. And so I put the feeding tube in, and then her brain just continually got worse and worse until she was a little shriveled up person in a nursing home in Enfield. And that's how my mom died.
Did she get any bed sores before she died?
Of course she did.
She
got beds. She never woke up. She was fed. I fed her through the feeding tube. So
and you truly felt you were doing the right thing?
I did. Yeah. I certainly did.
Yeah. And you know, unless we docs, and it's going to take more than just the docs, because it's going to take education in general for all of us. Like I say, 30 years ago was different. But I was going to say, Dr. Don Bells and I were talking the other day, and we agreed that I would say far over 50%, I would far over 50% of the bed sores that are people suffer, I think are created by the medical system doing stuff to people.
It's probably true.
Most people tend to say, especially believers, they will say, I want a natural death. But we got to define what a natural death is, okay? And unless the docs and nurses can really communicate well with the family will fall into what you did is, well,
That's
got
right.
to provide
That's
nourishment.
right. That's
I mean,
right. That's
I
right.
can't let mama starve to death.
Right.
Well, if they have dementia, and here I go. They have
It's
dementia.
time for a break. We're not going to hear all this. Go ahead, finish your thought.
If they have dementia, sooner or later, yeah, they're going to stop eating.
Yeah.
It's part of the dementia.
They're going to forget how to eat.
They're not going to die. They're not going to starve because you're not feeding them. They're going to not eat because they're dying from dementia.
Right.
And you're not fixing the dementia. All you're doing is
Prolonging their life. All right, it's time for our first break, and when we come back, I'll try steer them away from dementia, but I kind of like this subject myself, so we'll try be good. So listen to our sponsors, and we'll be right back with more of Here's to Good Health. Don't go away.
At Down East Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Down East Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Down East Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
Are you suffering from Medicare and Medicare supplement confusion? As you prepare to turn 65, I'm sure you're already bombarded by Medicare supplement mailings and phone calls, as well as information regarding your annual enrollment period, October 15th through December 7th, which is the time of year you have the opportunity to change your Medicare plan. Don't be frustrated. Don't stay confused. Call Gus Tellis. He can get you into the right plan that will work best for your needs. The annual enrollment period deadline is fast approaching, so don't wait. Call today and get the peace of mind that comes from knowing you're covered.
Call me today, 252-937-6913.
Hi, I'm Richard Koss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
Hey, welcome back. This is Here's to Your Good Health. I'm Linda Preziosa. I'm here with Doug Boyette, and he is the medical director of the Nash UNC Hospice. And he has been telling us a story that is fresh in his mind. I'm sure it's been heartbreaking for him because we can't be involved in a situation, as Dr. Boyette said, we are human too. We have our own feelings, and when you're involved with a family and involved with an impending death of a family member, and especially in this situation because the gentleman was so young. So go ahead. So he.
Okay. So he is on the respirator, on the ventilator, for a period of time, weeks, no more than 2. I think it was 14 days. But anyway, the scans, like the MRIs, didn't show necessarily the severity of effects that you would expect from lack of oxygen. It showed effects, don't get me wrong. It was clearly abnormal, okay? But you got to realize when you got a neurologist and docs, you want to be hopeful and you want to be as encouraging as possible, but my passion is be 100% honest. You don't sugarcoat it. How are families going to make reasonable decisions if they're not told the truth? So just be careful how you say things. But anyway, wife made the decision, and she was, the way the law goes is if you have not appointed a health care power of attorney, then it'll be your spouse, and then it goes in stepwise. Guardian always trumps everybody, okay? Guardian, spouse, and then it's majority of first degree relatives. Well, one problem with that is, and it happens all the time, when the children are left, adult children, and the spouse is dead already, then if there's one child that's an outlier, it's usually if it's a male out of town.
Yep. Hasn't seen mama in 6 months.
Yep. And they're not there day in and day out to watch what's really
decline
going on.
and the demise. Yep.
They're going to be, and they always use these words, and please be careful how you use these words. Well, I know my mama and she's a fighter. Well, you can be a fighter all you want, and that's great, and that's culturally, that's wonderful. But you're still going to die. Okay, I don't care how much you fight. You are going to die. Okay, and let's come to grips with that. Now, if they have dementia, then that fighter that you know
is gone.
Yeah, they're not what they were.
That's right.
And so, look at what you're really dealing with. More importantly, when you're making these decisions, what would that person want? That's your job. Your job's not to figure out the right thing. Well, the decision making fell to the wife. Here's the blessing. I know they had living will. I'm not sure if they had a health care power of attorney, but doesn't matter. She would have been, I'm sure he would have appointed, because she's got guts, And when you're sitting there at a time like that, and you're trying to figure out what all these groups of doctors really think, it can be difficult. It can be imposing. And I don't want them to think I don't care about my husband. I'm just going to let him die. And all that enters into the equation. Well, she knew that her husband would not want that darn tube down him. They'd given it a while to see if he would respond. You're probably coming up on time to start talking about putting a tube in, Trey. Then you talk about putting a hole in his belly to put a feeding tube in, rather than down the nose. And if you've ever had the feeding tube down your nose,
oh, it's awful.
It's aggravating. Been there and done that. Okay. So it's decision-making time. Well, she very appropriately, very wisely said, well, we're going to take him off the respirator and see how he does, step number 1. This is about the time I get called in. Quite honestly, all the docs and nurses, not everybody was totally on the same page, because you can't be. You know, you don't know exactly, okay, best case scenario, what's going to happen. You've got neurology saying it's going to be significant brain compromise, no question about that. Now, are you going to end up, best case scenario, in a long-term care facility for the rest of your life, being fed through a tube and be able to perhaps know who people are that come in to see you, or the family's not sure if you know. You know, it's kind of how probably was leaning. Well, fortunately, this couple had talked to each other about this in the past. So often, families, when it comes to talking about dying and feeding tubes and stuff like that, somebody will be all, we don't want to talk about that.
We're not going to talk about that.
Yeah. Unfortunately, they had talked about it. And this lady knew exactly what her husband wanted. He had said to her, do not let this happen to me. And what I tried to emphasize to her, and what I would emphasize to the public I'm speaking to now, is the huge blessing that this gentleman gave to his wife, okay? As I said to her over and over and over, you do not need to make a decision. You're placing that burden on yourself because the doctor asking you, okay, what do we do, what don't we do next? And you feel like you need to decide. You do not. Your job is to be his voice for him. He has already answered the question. And I can't emphasize to people how important that is, because she was thrust into a situation to make decisions that she was not prepared to make. You, 30 years ago, were you a nurse then?
No.
Well, even if you'd been a nurse, you still might not have been prepared to make the decision, because unless you had dealt with end-of-life issues and stuff, you know, you might have been in labor and delivery like me, you know?
Yeah, and you know, when you got all that emotional stuff going on, it's near impossible. I've been a nurse for a long time, but if my kid breaks his arm, I still want to take him to the ER and let them deal with it, because I'm going to be a mama. I'm not going to be a nurse.
I'm a wimp when my kids get sick, okay? When my kid's sick, I'm a wimp. Now it's
but if I was sick, you'd step right up.
Yeah, sure.
That's no big deal.
But she made the decisions, what would be done, what would not be done, focus, be on comfort. And he was kept comfortable. She continued to make excellent decisions as far as parroting what he had said to her. And he did ultimately die. Doctors, that is not a failure.
No.
We tend to feel like, well, what else could we have done? You know, once again, death is usually, in these cases, not the enemy, okay? That this is a gentleman that, like myself, I would much rather the stuff be stopped and you either sink or swim. And I figure if I thrive, that's God's will, my body's strong enough. If I don't, then I don't.
Right. Right.
But she did a great job. But she did a great job. She would have probably done the right thing anyway. Well, I shouldn't say right thing. She would have probably made the same decisions regardless. But she can always know she did exactly what she was asked by her husband to do. She fulfilled those vows that she made on her wedding day. And I can't commend her enough.
Wow. That's a great story.
And you know, we deal with that a whole lot in hospice. I think you were supposed to ask me hospice questions, but I couldn't help but do the advanced care thing.
No, that's so important.
Well, and Linda, let me tell you this. Okay, very experienced nurse and a very experienced doc didn't totally see eye to eye in this case, okay? Now, none of them were strongly opposed to what was done, obviously, or you know, they would have to ethically say so. You know, they did not think this lady was not making good decisions. But one would have probably done more stuff for a while. Would have ended up at the same place. But they had to step back and say, whoa, what is our real goal here? What is our real goal? Because it's easy as a doc to get lost into, I got to do something.
Yeah.
Like feeding tube, you know, with mama.
Because that's how we're trained.
Yeah.
You know?
And unless you realize that, well, there are times when if somebody's not eating, there's a reason they're not eating.
Right, that's right.
The disease.
That's
there can be a lot of things. ALS.
Oh, yeah.
You know, you can go on and on and on. I'm not saying starve people, and let the public understand clearly, okay? I'm a Christian. That is first and foremost above everything in my decision making. I do not believe in physician-assisted suicide.
No, I don't know.
I would love to have that conversation and love to have people call in and give me a hard time on we treat our animals better than we treat each other and stuff like that, and a lot of that makes sense. But I want you understanding where I'm coming from, that I don't believe in that, but I think not putting a feeding tube in and, quote, allowing somebody to die from starvation, which is not accurate, but is acceptable in certain situations. And that is not me deciding life or death.
Right.
The disease process decided that.
And if the people are not fed, it is not painful. They move.
If they're not hungry.
Right. But they move into a state of euphoria almost, don't they?
There's a lot of research about that as far as endorphins and enkephalins. Now, I don't know what they're called this week. You know, we truly learn so much week by week by week in medicine. But I can tell you, as far as we can tell, folks that cancer people at the end, you know, they just won't be hungry. And dementia folks won't be hungry. The brain's not sensing. And bear in mind, primitive brainstem functions, in order, you will stop eating, you'll stop drinking, you'll stop breathing. Now, they come very quickly once they start. But me personally, I would have to always offer my loved one food, but I would not force it down. And what happens is there's always a nurse aide or a family member that can, quote, get mama to eat. And, you know, I have mixed feelings, but...
Well, there's the medical end of it, too. If you feed and they don't want them, then they're going to aspirate, and then you got pneumonia, and then you got a whole nother problem.
They do aspirate, you know.
So.
Just like dementia folks, I don't want a swallowing study on a dementia patient. Okay?
Absolutely not.
Yeah, but they're done all the time. Well, why? Because mama with dementia is brought into the hospital because they're not acting right, and it's always going to be an infection, urinary or pneumonia from aspiration. And so if you're the emergency room doc, patient's brought in, aren't they saying, here, doc, do something?
Sure.
We don't understand what's going on. A family, if they understand, and that's where my passion is for hospice to be involved and prevent that patient from coming to the emergency room. Now, I'm not talking about early onset dementia, but when it has progressed to a point, at some point you're going to have to make a decision. And honestly, that's when we create bed sores most of the time. Because it's called the death spiral. They come into the hospital with infection, urinary or pneumonia. Okay, they're dehydrated always. So they get fluids, they get antibiotics, they get better. They go out better than they were when they came in, but not as good as the last time. Right. And they do it over and over and over. Their body gets weaker, weaker, weaker. Their protein goes down, down, down. They're lying on the same spot because their brain doesn't sense, hey, my butt's going to sleep where it hurts.
Right.
They don't sense that pain normally. So they lie there, get bed sores, and it just goes on and on. And the family's not being told by healthcare workers that this all goes back to the dementia. I think if family understood that, they're apt to be more comfortable with saying, but do I really need to be giving fluids and antibiotics to mama because I'm just prolonging agony and I'm not helping her.
Right.
But
And you know, a lot of patients, not the dementia patients, but other patients, not necessarily this case either, because that was kind of a, you know, critical event, but for someone who either is in that death spiral or is just 92 years old and gets pneumonia, and they will say, I'm just tired, I just want to go home.
Linda, I've told people over and over, when an older person, especially, number one, family, they know what's going on, okay, unless they're totally demented, okay, but if they can still reason with you and you're trying to tiptoe behind them, like, well, don't use the H word, don't say hospice, okay, mama will just give up, okay, well, she might because we, our culture, have been so ignorant about this, is that we think, well, that means they come in, fill them full of morphine and let them die.
Right.
Well, sometimes
that's
that's all we can do.
Right.
I mean, they're suffering, they're writhing in pain. If you'd called us months ago, you know, we could have helped you through this and mama wouldn't have had to suffer all this time.
That's right.
But we don't want hospice. We're not ready for that yet. But when somebody like that looks up at you with that look in their eyes and they say, I'm tired. That's code for, let me go, please.
That's right.
Just keep me coming.
That's right.
I mean, they're really begging.
Yeah. That's their way of saying, I want to go make sure it happens, but they don't use those words. And I've seen that over and over. I worked in a hospital for 23 years, so I saw plenty of it in those years that I was there. So, all right, we're going to take our next break, and when we come back, we're going to talk about COVID. How has that impacted hospice? And why what is the benefit for the family? That's, you know, when I worked at the hospital, I never worried so much about the patient laying in the bed. I worried about the person sitting in the recliner next to them, because it's terrible to be a caregiver and, you know, you have to let go of everything and let strangers take care of your loved one. So I was always worried about them. So what is beneficial for the family with hospice? So we're going to be right back and we're going to talk about those things. Don't go away. Hang on. We'll be right back with more Dr. Boyette, and here's to your good health.
At Downey's Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Downey's Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Downey's Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
Are you suffering from Medicare and Medicare supplement confusion? As you prepare to turn 65, I'm sure you're already bombarded by Medicare supplement mailings and phone calls, as well as information regarding your annual enrollment period, October 15th through December 7th, which is the time of year you have the opportunity to change your Medicare plan. Don't be frustrated. Don't stay confused. Call Gus Tellis. He can get you into the right plan that will work best for your needs. The annual enrollment period deadline is fast approaching, so don't wait. Call today and get the peace of mind that comes from knowing you're covered.
Call me today, 252-937-6911. 6913.
Hi, I'm Richard Goss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.
We're back. This is Here's Your Good Health with Dr. Doug Boyette. We've been talking about hospice and palliative care, why you should have it, when you should talk about it. Obviously, in your 50s, perhaps, especially, there's something known as a widowmaker, which is a, I think it's a, isn't it the, oh yeah, you know all about that, don't you?
Yeah. Doesn't there none of that?
Yeah, he had that himself. But that happens usually late 40s, early 50s, I think.
Very common.
And it's called the widowmaker because normally the patients do not come through it. Obviously, Dr. Boyette did, and God had another plan for him. Now, this gentleman he was talking about just passed, and God wanted him home. We don't know why, we don't know what the ins and outs are, but that's not for us to decide. But so the time to talk about these things is not when Grandpa's 80, it's when Daddy's 50. And in this case, the wife and husband had talked about it. And you know, it doesn't have to be a long, lengthy 3-hour conversation, but you just, I mean, my husband, if I allowed him to be intubated at this point, he would come back from heaven and haunt me. I'm telling you, he would. And I've got
I would too.
A pastor that said, I'm in a tattoo, do not resuscitate on my chest, because if I've died and gone to heaven, do not bring me back into this world. And so, you know, it's just good to talk about it.
You know, what you just said, as doctors and nurses, we're all about getting clarification on the code status of the patient, you know. Full code, do not resuscitate, do not intubate, all of this. But I don't know of many people that were taught how to do that, you know. They tend to go in about and say, well, Mama's heart stopped beating right now, would you want us to do anything about it? Well, that kind of sounds like a slam dunk. Well, yeah, I want you to do something about it, you know. But that's not really the question. And depending on the situation, I think it's more appropriate to talk from the standpoint of, okay, Mama's sick with this, this, and this, and if she were to have a natural death, would she accept that? And would the family say, well, Mama's always been comfortable with that? Well, there's you do not resuscitate right there.
Right.
Okay? but it's put in a more palatable way. Not that I don't dare want to try to talk somebody into something, but you know, there's an element, and I don't think this is not necessarily not justified. There is an element of, well, we're in this hospital around all these strange people, and I don't want them to neglect Mama, so maybe I ought to tell them to do everything. You know, it really does take discussion. Claire?
Yeah, because people think, oh, you go to hospice, you just die. It's, you know, you'll be dead in a week. Well, that's not the case. Yeah, you're going to die. We're all going to die. But there is a path leading to the end of life that can be comforting and beautiful and satisfying to the patient and to the family. So what kind of benefits are there for the family with hospice?
Family has a lot of benefits. Bear in mind, when hospice comes in, we come in as a team, and this is really, Medicare pretty much drives what goes on with hospice because most of the folks are older. And insurance companies tend to copy Medicare as far as rules. But the rules are, most importantly, there's got to be 2 doctors that agree to this. Would you be surprised if this patient were dead within 6 months? That used to be pretty much the gold standard to get. Across the country, there are a lot of for-profit hospices. So the Medicare payments for hospice across the nation skyrocketed because these for-profit hospices would enlist all these patients that were like nursing home patients that, no, you wouldn't be surprised if they died, but did they really need hospice at the time? So that's problematic. Well, as far as what we have to provide, we're a team. And oddly enough, your government, okay, mandates that you have to have spiritual support.
Wow, that's surprising.
You would think that, heaven forbid, we do that.
Yeah.
Now, once again, me as a Christian, been in Muslim homes, Baha'i, Buddhist. You know, it's not my place to go in and ram anything down anybody's throat. But the spiritual component is there. You also, so the chaplain, you have to have a social worker that can be very helpful with, you know, finding, not necessarily funding sources sometimes, but lots of things. She actually does something. She doesn't just fill out papers. I think the social workers out in the community would love to have that job because you truly make a difference with these people and their families. Nurses go and see the patient at least weekly. Most of the time for us, it's twice a week. Some of them don't want to be seen every week. They're not that sick at that time. But the nurse may be going every day or several times a day, depending on what the need is. But also nursing assistants that help with bathing and personal care. They are not there every time Mom has a dirty diaper. You, the family, are the hands-on care. But the way you should view hospice, you should think about hospice in 2 settings. One, when, okay, not that we don't care, but we're not going to take Mama back and forth to the hospital.
Right.
Okay? That confuses her. It's not giving us the benefit that we would want. She does not want to go there. So we're not going to the hospital. That doesn't mean we're not going to do some sort of medical care. So now what do you do? Because if you get an emergency room, they're going to say admit to the hospital.
Right.
And that's
and then you got to stop that DNR too.
That's where we're strong. And, you know, when I first started, everybody assumed, you know what you do when you assume, that anybody on hospice had to be a do not resuscitate. Well, I changed that rule right away because you got to understand, you've got this precious little old lady who's been married for 50 plus years, and the 2 of them are like this, And she views do not resuscitate as I'm giving up on my husband. Now, if you talk to her and say, well, if he died a natural death at home, is that okay? Well, yeah, sure. Why should I force her into signing something that she might feel guilty about when it doesn't really matter? It's not going to change the outcome. So try to meet them where they are. But that's what hospice is to be, is we become part of the family.
Right.
So you're seeing them a lot. And the neat thing is they develop trust.
Yes.
And so when it's time to make various decisions, they'll want our input. Okay? It's not, what I try not to do is go in there, stop all their medicines. Because even though most of the time they're taking medicines that they don't need to be taking. But I don't want them to feel like, well, hospice just came in here, took everything away, and didn't care. You know, so you have to be careful. But that's what hospice is.
Well, in hospice, I know from my son-in-law, whose mom was in hospice, that the family really developed a relationship with those nurses, one nurse, well, I think maybe it is one nurse, but anyway, and they trusted her. They felt comfortable with her. They liked her, and that helps the family when you've got a healthcare professional that comes in that cares about mama. Maybe doesn't love her as much as you do, but they really care about mama, and they want what's best for mama.
No question, no question. And I'll tell you, working as a team, you know, I learned when this nurse uses these words, this is what they mean. When this nurse uses the same words, this is what she means. And even the aides will tell us many times when somebody's going to die. She's not going to make it through the weekend. So, you know, girls kind of plan for what's probably going to happen. And, you know, when they're experienced, they're usually right. And you can help the family prepare, you know. Somebody might want to come in from out of town. Some families, it's very important that mama not die alone. It just depends. And so while we can't always guarantee that we can tell them, many times
you're pretty close, aren't you?
But we try to be a part of the family. I will say, I will confess clearly, and this is the way the system is designed, the nurses are your most important link here. Okay, you may never see a doctor. In our case, I don't have a regular practice anymore. Okay, my heart is worn out of that. I physically can't do it, but I do visit patients and families and love that part of my job. But the nurses are really the in the trenches, hands-on, doing the work, and it gets to the point, which I think is good, they value what the nurse would say more than they value what I would say.
Sure.
And that's appropriate. That's fine.
Yeah, because they know that nurse loves that mama. Yep.
Yeah.
All right, well, it's time to say goodbye. I didn't even get to COVID, but I guess COVID hasn't really stopped you from going into the house.
COVID, you know, we mask up and all of that kind of stuff. I got in trouble one time because I was given permission not to mask by the family, but the daughter didn't like it, you know. I try to meet people where they are.
Sure.
But we do all the precautions. But a lot of times, and especially, I don't move my upper lip much anyway. And you got that mask on, and I'm mumbling.
It's hard to understand people sometimes with the mask on, that's for sure. I found myself, what? Could you repeat that, please? All right, thanks so much for joining us. And Christmas is coming, so don't be afraid to talk about this with your family members. If mama, you know, and daddy are in their 70s or 80s, it's okay to talk about it. It doesn't have to manipulate the whole Christmas conversation. It can just be a short little piece of it. I will not be back now until after the new year, so you all have a great Christmas, a happy new year, and we will see you next year with more of Here's to Your Good Health. Good night.
At Down East Hearing Care Associates, we are dedicated to taking care of every client by providing personal, high-quality hearing care services. My staff and I know hearing loss affects each person and their loved ones differently, so we give you the time and the care you need to ensure the hearing technology chosen fits your lifestyle. At Down East Hearing Care, we also make custom ear molds and specialize in emergency hearing aid repairs. Down East Hearing Care Associates has 2 locations, one in Knightdale and one in Rocky Mount. We have hearing lives to save.
When faced with special care needs for elderly or disabled loved ones, families want compassionate, comforting care. That's Tender Touch Home Care Services' goal, providing the level of care we would expect for our own. With over 10 years of home care excellence, Tender Touch provides an array of services that keeps your loved one at home. From personal care, light housekeeping, errands, and meal preparation, to our private duty care program, which combines all of our home care offerings in one package.
Tender Touch Home Care Services, where your needs are our concern.
Are you suffering from Medicare and Medicare supplement confusion? As you prepare to turn 65, I'm sure you're already bombarded by Medicare supplement mailings and phone calls, as well as information regarding your annual enrollment period, October 15th through December 7th, which is the time of year you have the opportunity to change your Medicare plan. Don't be frustrated. Don't stay confused. Call Gus Tellis. He can get you into the right plan that will work best for your needs. The annual enrollment period deadline is fast approaching, so don't wait. Call today and get the peace of mind that comes from knowing you're covered.
Call me today, 252-937-6913.
Hi, I'm Richard Goss, pharmacist and owner of Almonds Drug Store here in Rocky Mount. Here today with my wife and 2 daughters. For over 75 years, Almonds Drug Store has been the pharmacy of choice for residents of Edgecombe and Nash County. Our family is proud to call Rocky Mount home, and we are excited about the new services and products we are adding daily at both of our Almonds Drug Store's locations and also at our medical supply store.
Come in and see us at Almonds Medical Supply. We're an extension of Almonds Drug Stores, your local hometown pharmacy. We're here to service all your needs, from wheelchairs to walkers to orthopedic supports to compression hose to hard-to-find wound care supplies. And you'll always get that hometown customer service.
We want our patients to pay the best prices, get the best service available, and have a better pharmacy experience than they will get anywhere else. Our staff is committed to going above and beyond to meet our patients' needs. Whether it is working with your provider to get you the best medication at the best price, contacting your provider to get you refills or a prior authorization, or taking the time to review each of your medications with you personally, or perhaps even helping you find an old-time remedy or other hard-to-find items, your Almonds Drug Store staff will work hard to meet your pharmacy needs. At Almonds, we will deliver your prescriptions for free. Both of our stores have drive-through windows, we guarantee short wait times, and our pharmacists will come out to greet you personally and answer any questions you have. If you want to be met with a smiling face, or even want someone to greet you by name when you walk through the doors, we are the pharmacy for you.
Call Almonds Drugs today.
443-3138 or 446-0014.